wait for our cameras to come up here, folks, because we, unfortunately, Instagram is always a little strange and everything else. So we're ready. Welcome. Glad you could be here. I am Dr. Joe Esposito, and the first time joining us, I'm glad you could be here. We get new followers and new people watching, of course, constantly. So the way this works is I talk for 24 minutes. I will talk about a topic, good topic today. And you, whatever platform you have, if you have any health questions, type the question in the search in your platform. John, my producer, will then go ahead and read me the questions at the 24-minute segment. I will hopefully have an answer for you. Can't answer everything, but I'm usually pretty good at this stuff. And then I'll do another 24 minutes, and then we'll do another question and answer session. So this is an excellent time for you to have contact with me, and if you have any health questions, get those answered, because all of us have health questions. I have health questions, and this is a great opportunity to get those answered. So for you, your friends, your family, this is your chance. So feel free to do that. Share this with everyone in your contact list, because it's really good information. And everyone who listens to it says the same thing. How come I've never heard this before? And I've been doing this for 40 years. And every lecture I give, there's something new and different in it. So it's a good time to get some new information. So I am ready to start whenever you are, John. All right. Let me, okay. Ready? Hey, folks. Dr. Joe Esposito here. I am glad you're with me today. We're going to talk today about supplements, drugs, and your health, because certain drugs will rob the body of certain nutrients. And I have this fantasy, I wish that when people were prescribed medication, that they were also saying, hey, listen, if you take this supplement, it's going to deplete these, take this drug, you're going to deplete these nutrients, make sure you take these as a supplement as well. Doesn't happen. In fact, I've never heard it happen in 40 years. So we're going to cover that today. I want to start out with vitamin D. And this isn't really drug and supplement interactions, but this is so important that you understand this. More evidence is showing that vitamin D can help combat cancer. Now, let's get into this. Low levels of vitamin D are linked to increased risk of cancers, and vitamin D can attach to something called a vitamin D receptor. It's called a VDR in your cells, and it sets off a series of signals that can affect how the cells grow, develop, and survive. Now, this is so important. My sister died of breast cancer. I've had other people in my life die of cancer. And many times I've tried to talk to them, and they wouldn't listen. And as my sister, got into her final days and she passed, I remember thinking, she was a nurse, so she knew more than I did. And so she thought. And I remember thinking, that really just sucks. I wish she just listened to me. But she would take, marinara sauces and meat sauces and microwave them in plastic. Well, plastic has chemicals in it, especially when it's heated in a microwave with an acid like spaghetti sauce, that can increase the risk of cancer cells and cell growth. And she said, well, I talked to my oncologist, and he said that has nothing to do with it. Even if it had nothing to do with it, why not do it a different way? I always say, let's assume I'm wrong. So what? I'm wrong. There's no harm in doing it the other way. And that's what so many people do, or they don't even know there are options. So with vitamin D, it kind of acts like a brake. It puts a brake on the process of cell growth and a lot of tissues in the body, and it helps control the speed at which the cells multiply. And that's what cancer is. It's uncontrolled growth of cells. And when they grow so fast, they can't differentiate. So they don't necessarily become active breast cells. They just become junk cells. Same thing with prostate or lung or whatever it is. So it's just overgrowth of cells growing too quickly before they can mature. That's a real simple way of putting it. This is really important because cancer, one of the key features is cells overgrowth, and they just get out of control. So let's put the brakes on it and let those cells mature and become real cells as opposed to becoming cancer cells. So vitamin D has been observed in animal studies to help delay age-related changes by activating other important pathways in the vitamin D receptor pathway system. So whenever something happens in your body, it's a pathway. This becomes this, becomes this, becomes this. And there are certain times where there's a kink in the armor. And it just stops at one point, or it goes off in a different direction. And you want to make sure that that pathway works smoothly. And vitamin D kind of helps mitigate any issues that might be in there. Now, there's a molecule, it's called NRF2. And it plays a critical role in protecting the body against something called oxidative stress and DNA stress. Oxidative stress is free radicals. Free radicals are like Pac-Man. They attack and eat through things. And so vitamin D can help calm that down and slow down that oxidative process. And these are two problems commonly linked to development of cancer. They attack the cells become weak, they start replicating, and we have this abnormal cell growth. Worldwide, cancer is the number 2 cause of death behind cardiovascular disease. And the nice part about cardiovascular disease and cancer, if there's such a thing as a nice part, is that many of the problems that cause it, you brought on to yourself. They're self-induced. So if you understand what you're doing, many times you can stop that. Stop doing the things that are causing the problem. And a famous man once said, "Forgive them, for they know not what they do." And I see this all the time with patients. I see it with people in the grocery store, people calling my radio show, go to my website, and they never knew vitamin D can help. Is it going to cure cancer? No, it's not going to cure cancer. Can it help? Yeah, the studies are pretty clear that it can help. I'm going to talk about how to take it and what type to take as well in just a second. So deficiency, vitamin D deficiency is at a level called 20 nanograms per milliliter. Now, when you get your vitamin D tested, it's measured in nanograms per milliliter. In Europe, it's a different measurement. But here in the States, nanograms per milliliter. If you have 20 or below, you're deficient. Insufficiency is between 20 and 30 nanograms per milliliter, and that's about 40% of the people in the world. Some studies come as high as going up to 80, 90% of the people in the world. Now, 40 nanograms per milliliter is considered okay. That's the safe zone. I'm going to get into this a little more in just a second, but I want to give you a spoiler alert. I don't like 40. I want you at 60 to 80 nanograms per milliliter. That's when you start to see the effect on cancer. It becomes, I want to say medicinal if that's the right word. It becomes really effective at 60 to 80 nanograms per milliliter. And so you should get your blood work tested. And when you do, always ask for a vitamin D test. It's real cheap. And if it's too low, you take more. And I'm going to talk about different types of vitamin D and how to take it in just a second. So research shows if you can reach a minimum serum vitamin D level of 40 nanograms per milliliter, that's, again, too low for me, but that's what the accepted level is, your risk of cancer diminishes by 67%. Now, if I had a pill, and I can sell you a pill that will reduce your risk of cancer by 67%, I could make a lot of money on it. But there is no pill. Well, it could be in a pill. Vitamin D. The problem is we can't patent vitamin D. Now, you can. They have a synthetic version called vitamin D2, and that's the form that many doctors prescribe. I don't like that form. I like vitamin D3 because vitamin D2 has to be converted into vitamin D3. So why not take the vitamin D3 anyway? And I'm going to talk about how to take it in just a second. So if you have 20 nanograms or less versus 40, you reduce your risk of cancer by 67%. I've always said vitamin D is the cheapest insurance policy you'll ever buy because you know insurance is expensive. Vitamin D is literally pennies a day. It's ridiculous how cheap it is, and I don't know why it's not standard that everyone has to take it. And you can take a liquid form. That's how I take it, and it's so easy. It's so inexpensive. It has no flavor. I mix it in with Dr. Joe's Super Greens and Dr. Joe's Essential Source. We're going to talk about supplements a little further. But Super Greens and Essential Source are 2 powders. I take a scoop of each. I shake it up with some coconut milk or almond milk. We have shakers on our website if you want to get a shaker. You can use a shaker or just a glass jar is fine. And I add about 10 drops of Dr. Joe's vitamin D3. That's about 10,000 international units. That's the level that most people do well at. Now, can you become toxic with vitamin D? Yes. How much would you have to take? Probably about 100,000 units for several weeks a day before you have any toxicity. So 10,000 international units a day. It's 10 drops. No big deal. Very inexpensive. So there's a study. It's called Grassroots Health. It was analyzed. It was published in something called PLOS One, which is a journal. It's very prestigious. It showed women with a vitamin D level above 60 nanograms per milliliter had an 82% lower risk of breast cancer compared to those with lower. Now, to play devil's advocate, if you're taking vitamin D, chances are you're probably health-oriented anyway, and so you may just be living a healthier lifestyle, but this is the one thing that they did measure. Risk of lung cancer, colorectal cancer, breast cancer, bladder cancer, and lymphoma are higher in people with lower vitamin D, and having higher levels is associated with better prognosis in breast cancer and colorectal cancer. So even if you have the cancer, it ain't going to hurt to get those vitamin D levels up to 60 to 80 nanograms per milliliter. So it has these anti-cancer effects, and let's talk about how that works. This one study, a Journal of Steroid Biochemistry and Molecular Biology, I'm sure you probably have that in your bathroom right now, reading it every day, pointed out vitamin D is widely recognized an essential role in regulating balance of minerals in the body, but it also has anti-cancer effect. What does that mean? It targets different stages of cancer development and progression, including initiation, growth, and the spread of cancer cells. It also is anti-metastatic, which means it helps prevent the cancer from spreading. Kind of important. And also anti-tumorigenic. The vitamin D can help prevent tumor formation or the growth of the tumors. So it's inexpensive, it's readily accessible. Most people are deficient in it anyway. Why wouldn't you take it? And again, it's probably the cheapest insurance policy you'll ever buy. So it did a review in this one study, and vitamin D's role against the following cancers, and this was really impressive: breast, colon, squamous cell carcinoma, osteosarcoma, prostate, glioblastoma, which is in the brain, ovarian, head and neck, bladder, melanoma, and multiple myeloma. That's a lot of omas, isn't it? And for 5 drops, 10 drops a day with no flavor, it's great. And the nice part is you can even give it to kids because it has no flavor. You could just, as you're making whatever you're going to make them, squirt a little vitamin D in there, and it's great. Now, when you take D3, which is the form I like, I also want you to take vitamin K2. Because vitamin D, we're talking about cancer and vitamin D today, but one of the many things vitamin D does, it helps you absorb calcium. And it takes calcium from your food and brings it into the blood. Vitamin K2 takes it from the blood and brings it into the bones. If you don't have enough K2, what's going to happen is your body is going to leave that calcium, in many cases, in the blood, and it can build up plaque in the artery walls and increase your risk of heart disease and hardening of the arteries. And we know that circulation is important not only for the heart, but for the brain, the sex organs, the liver, the spleen. So if you're going to take vitamin D, I wish you'd take D3, but if you're going to take D2, which I wish you wouldn't, but if you do, make sure you have enough K2 with it. And I wish doctors would say this, but here's the thing. I've been studying nutrition now over 40 years, probably about 45 years. I learn something new every day. Most doctors have zero training in nutrition. That's medical doctors. Chiropractors, maybe a little bit here and there, but that's about it. I've made a life, a career out of studying nutrition and biochemistry, and I'm still learning new things every day. So I can't expect my colleagues to know this stuff. It's not in their wheelhouse. I don't know how to prescribe drugs. It's not in my wheelhouse. I don't know how to do surgery. I have doctors I can refer to that are very good at that, and I'm very good at this. And that's why I have such a working relationship with so many different types of doctors. I'm even on a referral list for the Veterans Administration. So we have a big referral list of doctors we work with, and pretty much every day I'm in contact with some other branch of healthcare. Either I'm asking for help or they're asking for help. So navigating this healthcare world is very confusing. And you see hospitals advertising, you see these little doc in the boxes, these minute clinics. These places are everywhere. Do you know why hospitals set these up? Yeah, it's to treat patients, but it's also a referral network. You go in, hey, I'm nauseous, I'm weak, I'm dizzy. You know what? Let me rush you over right to the hospital right away. And now you get put into that referral network. Nothing wrong with that. But that's how it works. They're making money, and again, they're making money as you walk in the door in the doc in the box, and they're also making money when they refer you over to the hospital, and then you get put into their referral network. Go see this oncologist, see this gynecologist, see this whatever, proctologist. So it's okay. It's a referral network is all it is. It works very well. I love when hospitals advertise. Why are hospitals advertising? They're so big and they're so monstrous, but they want your business. And it's a business. Let's call it what it is. Healthcare is a business. And many times, and that's one of the reasons I like working with independent doctors, is they have a motivation. They want to make sure that you come back and see them. In a hospital, you're just thrown into the network. And you're not going to go back to the emergency room, chances are, for repeat business. And so that's why I like to work with independent doctors. I work with hospitals too. I work with, I don't work with, but I refer to hospitals if I have to. City of Hope is a cancer center. I have no affiliation with them whatsoever, but they do a really good job with cancer patients. And I'm happy to refer to them because they do a good job. So the reason I say all this is that I want to be the captain of your ship. I want to help you navigate through this healthcare maze that's out there and help you find doctors or hospitals or clinics that are going to be the best treatment for you and not just kind of be thrown into the mix. So if you'd like to make an appointment to come see us, in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. Go to my website, drjoe.com, drjoe.com, make an appointment. Who's a good candidate for our clinics? Neck pain, back pain, shoulder pain, numbness, tingling. I'm board certified in chiropractic. I'm board certified in non-surgical orthopedics. I'm board certified in pain management and double board certified in nutrition. So our approach to pain is different. We try to get to the cause of the pain, not just treat the symptoms. Nothing wrong with treating the symptoms, but we try to get to the cause. And a lot of people obviously like that approach because maybe they've been through the mill. They've had this injection, this drug, and this steroid, and they're not seeing the results that they want. It might cover up the pain, but it doesn't fix the cause. So go to my website, drjoe.com. Normally the first visit is $940. For my listeners, I've reduced that to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays on a follow-up visit, and a complete nutrition evaluation. I don't know anybody doing all of that at any price, certainly not at $299. The x-rays alone are going to cost you more than that anywhere else. So if you want to find out if you're a candidate for care, just go to website, drjoe.com. Now, you can book appointments through my website. If you have questions, you could send them to me through my website. I answer some days countless questions every day. So I'm happy to answer any health questions you might have. And let's see if we can guide you the right way to go. Do you need chiropractic care? Do you need acoustic wave therapy? Acoustic wave therapy is great when you start to get arthritis and joint pain. It breaks up scar tissue, increases circulation. Had countless patients over the years tell me, I was told I needed a joint replacement, and now I don't, after getting the joints lined up in acoustic wave therapy. If you need a joint replacement, I've got orthopedists on speed dial. I've got neurologists and neurosurgeons on speed dial. But let's see if we can prevent that from happening first. And chiropractic care is the most effective, least expensive treatment for back pain in most cases. I don't think that's even a thought process. Just do it. So drjoe.com. Our vitamin D, Super Green, Essential Source, Vitamin B Complex, we can talk about that later, and a bunch of other ones are all on our website, drjoe.com. You can order them. We ship them the same day or next day. I used to think supplements way back when I first started this mess of healthcare it was a luxury. They're not a luxury. They're a necessity. If your goal is to obtain and maintain good health, I feel you have to take supplements. Minimum supplements would be Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. I shake it up with some coconut milk or almond milk every day and drink it first thing in the morning. I add my vitamin D to it. B vitamins we're going to talk about. You pee out your B vitamins every day. You have to replace them. If you're not replacing your B vitamins, you can't obtain and maintain good health. And if you eat a perfect diet even, I'm not sure you're going to get everything that your body requires to function the best it possibly can. So anyway, we're talking today about vitamin D. We're talking about food, drugs, supplements, and your health. Prostate cancer, most common cancer in men. Low levels of vitamin D were linked to high levels of what's called dihydrotestosterone and in the prostate, and that's associated with progression of prostate cancer. Now, I want to go off on a tangent here for a second. How many of you have had your gallbladder removed? Raise your hand. A lot of you have. I see it every day. When the gallbladder is removed, now you can't digest fats as well as you should because gallbladder stores bile, and bile squirts out into the small intestine and helps you digest fat. Bile is like dish detergent. It breaks up fat. Vitamin D is a fat-soluble vitamin. It's really a hormone, but, for today's argument. So vitamins A, D, E, and K are fat-soluble. If you don't have a gallbladder, you can't break down fats properly, so it can affect your metabolism and absorption of fat-soluble vitamins. So if you have your gallbladder removed, there's a supplement I recommend. It's not one of Dr. Joe's supplements. I'm creating one, by the way. It's called Colacol. It's from if you send me an email through my website, drjoe.com, I'm happy to give you the link to it. Carry it with you. It's really cheap. It's like $18 a bottle, and you just carry it with you. And whenever you eat something fatty, whether it's fried chicken, which I hope you don't eat, or an avocado, you take one of these pills. Everyone I've done this with comes back to me and says, oh my gosh, I can digest food again. This is amazing. But it's not just about food digestion, it's absorption of, in this case, vitamin D. Now, you can get out in the sun and get vitamin D. Absolutely wonderful way to do it. You got to do about 20 minutes, 3 or 4 times a week. But the best thing to do is always get your vitamin D level checked. And I want you at 60 to 80 nanograms per milliliter. If you're not there, take supplements. one time in my career, somebody said their vitamin D was at 100, which was a little high, but they were taking excessive amounts of vitamin D. And I said, just cut back on your intake. And they did, and everything dropped back to normal. But generally speaking, the average American, average anybody, really wants to make sure they're supplementing with vitamin D. Now, if you're a landscaper and you work outside in the summer, chances are you don't need vitamin D. But when winter comes around, certainly between, probably middle of fall and middle of spring, even if you're outside all day, the UVB rays, the angle of the sun is different, and it's not able to interact with cholesterol to create the vitamin D that you need. So, yeah, vitamin D is important. And the levels, again, for cancer prevention, according to the research out there, is about 60 to 80 nanograms per milliliter. And that's where everybody should be anyway. So if you're just tuning in, I'm Dr. Joe Esposito. We're talking today about supplements, drugs, and your health. Now, I want to get into certain drugs that many people are taking and what nutrients are depleted when they take those medications, and then more importantly, what to do about them. Now, nonsteroidal anti-inflammatories, okay, ibuprofen, naproxen, these drugs are very common. In fact, I'm amazed when I walk around, like in places where, if I'm walking around an office, if I'm at the radio station, and I look at people's desks, and I'd say 50% of the people have it right on top of their desk. I get headaches every day. I got back pain every day. And I take these medications. Now, a lot of the folks who I work with have come see us, and of course, they're off the medications in many cases. But if you're taking nonsteroidal anti-inflammatories, it's going to deplete vitamin C and folate. So what do you do for that? Okay. I would take Dr. Joe's Essential Source, which is prebiotics, probiotics, digestive enzymes, complete multivitamin. I would take B-complex, because B-complex is going to have the folate in it, and that's going to be important. And I would also take glutathione. And the reason I say that is because glutathione helps clean out the liver. Whenever you take a medication, you run the risk of damaging the liver. Now, the liver is very good at healing itself. The liver has amazing healing capabilities, so I'm very impressed with what the liver can do. But if you're taking any medication, I'd strongly recommend you take glutathione as well to help protect the damage from the liver. Now, the liver can grow back very quickly. In fact, if I removed 70% of your liver, it can grow back. Only organ in the body that can do that. Can't grow back an eye, can't grow back a heart, a lung, a liver, a spleen, a prostate. Can't do that. The liver regenerates itself. That's how important the liver is. And so you want to take care of that liver, because if you're doing alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas every day, you're just beating the heck out of your liver. So stop doing it, first of all, and then give yourself some glutathione. So again, nonsteroidal anti-inflammatories, basically over-the-counter medications, vitamin C and folate. You want to take Dr. Joe's Essential Source, B-complex, and glutathione to help replace the damage. And again, if you're on medication, why are you in pain? Let's see if we can get to the cause of your pain and not just treat the symptoms. So that's kind of a cool thing. Opioids, I hope you're not on opioids. Again, if you are, it's probably for pain, but then you can get addicted to it as well. But my team of doctors are really good at managing pain without drugs and surgery. And our goal is not take you off the medication. Our goal is get you well enough so you don't need the medication. That's a different approach to healthcare. So for pain, come see us. My team of doctors are, my opinion, the finest in the world. And the reason I say that is they're handpicked by me, they're trained by me, and they're my personal doctors. They're the ones I turn to when I have health problems. So make an appointment on our website, drjoe.com. So again, opioids, vitamin C, folate, and potassium. So what do we do for that? Essential Source, glutathione. And opioids can cause constipation as well. And so we have something called Dr. Joe's intestinal formula, and that helps clean the bowels out. But Super Greens and Essential Source by themselves are very good at getting the bowels cleaned out too. So Super Greens has something called chlorella in it, and chlorella helps clean out the liver as well. So Super Greens, Essential Source, glutathione, intestinal formula if you're on medications and you're getting constipation from it. So what we're talking about today are supplements, drugs, and your health. Now, I can't tell you to take drugs or not take drugs. That's not my job. If you're taking medication, always follow your doctor's advice. But let's add this protocol to it. Let's add pain management. Let's add chiropractic to it. Let's fix your digestive system. Maybe you have acid reflux. We can adjust your stomach by pulling the stomach down away from the diaphragm. Many times fixes the acid reflux. I'm going to get to acid reflux after the break. So if you're on medications, look at the side effects, find out what nutrients are depleted, and then let's go in there and fix that. Not only fixing the nutritional deficiency, but fixing the cause of why you're taking the medication to begin with. Diabetes. Many cases of diabetes can be managed strictly through nutrition. Why wouldn't you do that? Same thing with cholesterol. Folks, got to go to break. If you have any questions, send it to me through my website, drjoe.com. Book an appointment to come see us. I'm Dr. Joe Esposito. Don't go anywhere. We're going to be right back. Okay. Christy approves. We can continue. What do you got, John?
Is it okay to use a caffeine serum under my eyes?
I don't see a big problem with that. Caffeine will tighten up the skin probably. I wish it was organic. I don't know if there is organic caffeine serum, but it's a lot better than drinking the coffee. So, all right, I'll give you that one. I don't want to be too strict. I'm trying to be a good parent, you know. What else you got?
Can I add Dr. Joe's Essential Source and Dr. Joe's Super Greens to my pancake mix?
Sure. No reason not to. Yeah, if you heat it for too much, you're going to destroy the enzymes. So pancakes cook pretty quickly. So I'd say yes. Never thought about it, but yeah, I don't have a problem with it. What else?
I just finished a week's worth of fluconazole on antifungal. What do you recommend I do to restore what I might have depleted?
Okay. Yeah, antifungal medications oftentimes do liver damage. Now, I don't know about that one specifically. So the liver protocol that I have is Super Greens and Essential Source, glutathione, B-complex, and vitamin D. So that's the protocol that I would suggest you do. I always itch my nose when I answer questions. I just noticed that the other day. I was watching an old video of myself. When I answer questions, I itch my nose, and I don't know why. So anyway, yeah, that's the protocol. Super Green, Essential Source, glutathione, B-complex, and vitamin D. And yeah, you're going to have to do that for probably a few months to rebuild that liver, because that liver damage is pretty bad with a lot of those antifungal medications. So what else?
Can a 16-year-old take your D3 drops?
Yes. Absolutely. Yeah, if they're old enough, I mean, even from puberty on, I'd say 5,000 to 10,000 units. If they're a child, probably half that, maybe 2 drops a day. So. What else?
Why, after 67 years, am I getting athlete's foot on one foot near the toe with fungus?
It's usually, athlete's foot is an internal fungal infection. It usually comes from the colon. And you have yeast. It's called yeast that grows in the colon. And at some point, as you get older, the good bacteria in your colon start to die off. The yeast don't die off, and they start to multiply. So the yeast then start to grow, get in your colon and grow. And then the yeast say, I'm bored. I want to go on vacation. So they burrow little holes into your colon and get into your blood system. Now the yeast is in your system. It's called a systemic yeast infection. And it floats around, and it wants to set up shop in some place that's warm and moist and where it doesn't get bothered. And where's a good place for it? Your feet. Warm, moist, dark, great place to grow fungus. The crotch is another one. The mouth is another one. So some people get it under their armpits, get it in the mouth. It's called thrush. So women, yeast infections in the vagina. So you probably have a systemic yeast infection. Here's the test I want you to do, and it's free. Get yourself a clear glass of water. Put it next to your bed tonight. When you wake up in the morning, don't talk, don't brush your teeth. Scrape your tongue with your teeth. Get a big mouthful of spit and spit into that glass of clear glass of water. Wait up to an hour. If you start to see little tentacles coming down, chances are you have a systemic yeast infection. And then send me an email. I'll send you a whole protocol for systemic yeast infection. It's not easy to get rid of, but you have to get rid of it because it can cause some real serious damage. So athlete's foot, vaginal infections, these are all symptoms that something serious is going on. That's why. You're getting older, your immune system's getting weaker. So, or maybe you took a bunch of antibiotics too. That can happen too. What else, John?
I used to get athlete's foot as a teenager, but now as an adult, I don't get it ever. Why is that?
You probably built up your immune system and got some good bacteria in your colon and knocked off the yeast. That's why. What else?
That is all.
Beautiful. All right, guys, we're ready for round 2. Okay, ready? Let me get a sip of my tea here. Hold on. I love my tea. And it's not caffeinated tea, by the way, because black tea, side note, oftentimes can absorb aluminum from the soil, even if it's organic. And so that's why I like to do herbal teas. And it doesn't have caffeine. Ready? Hey, folks, Dr. Joe Esposito, part 2. If you're just joining us, welcome. If you stayed with us, thanks for staying here. I do appreciate it. We're talking today about supplements, drugs, and your health. And what we're talking about now, this part of the talk, is we're talking about drugs and how certain drugs will deplete the body of nutrients. And that's why it's really important that you replace that. So I want to talk about acid reflux medications, antacids. Now, there's different ones. There's H2 inhibitors, there's proton pump inhibitors, antacids. If you're taking them, chances are calcium, B12, iron, and magnesium are not going to be absorbed properly because you need stomach acid to absorb these nutrients. So you lower your stomach acid, you can't absorb the nutrients. So for proton pump inhibitors, for example, vitamin D, B1, of course, folate, B12, that's a B complex, calcium, zinc. So what do we do about it? Well, this is going to be a novel approach. What if we fix the problem that's causing the acid reflux? That's a novel twist, isn't it? Many times what happens with acid reflux is the stomach, which sits below the diaphragm, is pushed up into the diaphragm. And there's a hole, a sphincter, in your diaphragm. And when you swallow food, the sphincter opens, food drops in a hole, it closes, you digest food, and you pass it on to your small intestine. If that sphincter becomes stretched out or weak, the stomach can push up through the sphincter, and that can give you your acid reflux. So over time, you can get a scar that forms around that sphincter. It's called Barrett's esophagus. And the surgery is they go in there and they stretch it out and try to break up the scar tissue. If the acid irritates the esophagus, it can lead to something called esophagitis, and ultimately can actually lead to esophageal cancer. So you don't want to have acid reflux, so you take medication to calm down the acid, and it works. It works very well in most cases. But you need acid. You need stomach acid to digest protein. So now the proteins aren't being digested properly. They pass from the stomach into the small intestine, partially digested, where essentially they rot, and that gives gas and bloating and other problems. So if we took the stomach that's pushed up against the diaphragm and pull it down away from the diaphragm, in many cases, that fixes the problem. Now, I can't tell you to stop taking medication. That's not my job. But if I can fix your stomach, then you can either decide or go to your doctor and say, hey, listen, is it okay for me to stop taking medication? Doctor usually says yes, and now you save a ton of money. But even more important than that, you're able to start digesting your nutrients properly and absorbing your nutrients properly. So if you're taking any type of medication for acid reflux, I'm going to suggest Dr. Joe's Super Greens and Dr. Joe's Essential Source. Another benefit to that is they're loaded with minerals which can help alkalize or neutralize acids in the stomach. And many times that alone helps with the acid reflux. Doesn't fix the problem, but it helps neutralize the acids in the stomach. And then it passes into the small intestine. So Super Greens and Essential Source, absolutely. B complex, absolutely. Because you're not absorbing calcium, B12, iron, and magnesium, and not just B12, B1, folate. It's a big issue. So Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's B complex. And we have something called digestive enzymes. And digestive enzymes actually help you digest your food more efficiently because, again, if you don't have enough stomach acid, taking a digestive enzyme many times can solve that problem too. I take the digestive enzymes every time I eat a cooked meal. Now, if I have a raw meal, like if I have a salad or something, I don't take digestive enzymes. But if I eat a cooked meal, and, I love making soups, and I'll make a soup, and I'll have soup, and if I don't have something raw with it, like a tomato or a salad or something, I'll take a digestive enzyme with it. And so digestive enzymes really can be your friend because they help digest the food more efficiently so you can absorb the nutrients. One of the big things with aging is our enzyme levels drop. So one of the best ways to fight aging is keep your enzyme levels high. One of two ways. Number one, eat raw food at every meal. Number two, take a digestive enzyme. And it really is one of my secrets to my anti-aging protocol is just making sure my enzymes are high. And the enzymes are also found in Super Greens and Essential Source. So more ways to get enzymes in the body. But really, when it comes to acid reflux, the best thing to do is actually fix the problem, not just treat the symptoms. You can take Super Greens and Essential Source and B complex and digestive enzymes and vitamin D and all that's great. But then come see us and let's see if we can fix that. And my team of doctors are really good at this because I have this problem. And when mine acts up, I have to have them treat me. And now mine acts up maybe once every 6 months. And what happens is I notice I burp a lot. I feel fat. I feel bloated. And I can't stop eating. And I can only hypothesize as to why that is. But my stomach, your stomach, produces a hormone called leptin. Leptin goes into my hypothalamus and makes me feel full. My stomach is pushed up against my diaphragm. Again, strictly hypothesis. I'm not creating the proper amounts of leptin, so my hypothalamus says, I'm not getting the message that you're full, so let's keep eating. And so those are my symptoms that I get when my stomach acts up, and bad breath. So by pulling the stomach down, many times that fixes the bad breath, and it also fixes the absorption, and then you can hopefully come off your medications as well. Once again, it's getting to the cause of the problem, not just treating the symptoms. If you take antidepressants, many times depression is due to the digestive system. The stomach is pushed up against the diaphragm. You're not breaking down proteins into amino acids. The amino acid named tryptophan becomes serotonin in your brain, and serotonin is one of the reasons why we get depressed, low serotonin. So by fixing the stomach, many times we fix the acid reflux problems. And we fix the acid reflux problems, we digest the proteins more efficiently. We get the amino acids to produce the serotonin, helps with depression. Depression, every case I've ever seen in my 40 years in practice, every case I've ever seen is directly linked, indirectly or directly linked to a digestive problem. There's a bold statement, isn't it? So if we pull the stomach down, many times that solves the problem, but it will deplete your B vitamins. Antidepressive medications can deplete your B vitamins, and so it's important that you take Dr. Joe's B complex with that as well if you're on those medications. If you take antibiotics, and again, sometimes you need antibiotics. I'm not against them, but they will wreak havoc on your digestive system because they kill off the good bacteria as well as the bad bacteria. If you kill off the bacteria in the colon, you don't kill off the yeast. Yeast are not impacted by antibiotics. And so now the yeast start to multiply. They burrow holes in your colon, go throughout your body, and settle in warm, moist places. Where is a warm, moist place? Your feet, your crotch, women, the vagina, your mouth, your armpits. Now you have a yeast infection. So you have a yeast infection because you took antibiotics. Now we give you anti-yeast medications which can cause liver damage. So if you take antibiotics, you want to build up the immune system right away. As soon as that antibiotics is done, actually while it's happening, because they can deplete B vitamins, vitamin K, calcium, magnesium, zinc, potassium, and kill off the good bacteria. So if you take antibiotics, again, that's your call between you and your doctor. Dr. Joe's Super Greens, Dr. Joe's Essential Source, B Complex, and Dr. Joe's Probiotics. Now, if you're going to take an antibiotic in the morning, take the probiotic at night, or vice versa, whatever your dosage is, because the antibiotic can kill off your probiotics. You don't want to do that. So I recommend probiotics first thing in the morning on an empty stomach. Take them on an empty stomach. They can survive. A lot of them can survive from the stomach into the small intestine if you do it that way, and then you could take your medication away from it, usually 3-4 hours or more away from it. That's a better choice. If you're just tuning in, I'm Dr. Joe Esposito. We're talking today about supplements, drugs, and your health. And this is an important topic because I don't know anyone who's never taken a drug in their life. I certainly have taken them. But what do we do about it? If you need them, you need them. What can we do about that? If you take steroids for anti-inflammatory, they can deplete vitamin C, vitamin D, B6, folic acid, calcium, magnesium. So what do? Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's Vitamin D, which these are the standards everybody should be taking every day anyway. But if you're taking medication, of course, you understand the side effects to it. If you're taking medication for osteoporosis, I find this one interesting. There's a lot of drugs out there we give you if you have osteoporosis. Women, you got to get on this drug, you have osteoporosis. Osteopenia is the early stages of osteoporosis. So same thing. And they'll put you on these drugs. And these drugs, they help make the bone strong. It's true, they do. But they really only build up the outside of the bone in many cases. They don't really build up the inside of the bone. So the bone has this hard outer shell, but the inside is still soft and mushy. It's kind of like a crispy marshmallow. It's hard on the outside, soft on the inside. They can deplete, ironically, calcium, phosphorus, and magnesium, which are the nutrients that you need to build bones. Kind of an ironic twist. So if that's the case, with calcium, many times you don't need a calcium supplement. In fact, I don't know, very seldom have I ever recommended a calcium supplement. One of the reasons you have low calcium is you have too high acid in your body. When you eat acid foods, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, what happens is the body uses calcium as a neutralizing agent. It neutralizes the acid in your body. And so now you may not have the proper amounts of the nutrient in the body. So you're depleting your calcium levels. It'll take it from the digestive system, take it from the blood, but ultimately it goes into the bone and steals the calcium from the bone. So a high-acid diet is directly linked in many cases to osteopenia and osteoporosis. What if we went to a low-acid diet? We cut out the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, or at least cut back on it. And we started replacing with foods that are high in minerals that can be used as buffers like calcium. Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's Vitamin D. If you take vitamin D, it helps you absorb calcium into your blood. Vitamin K2 takes the calcium from the blood and brings it into the bones. So you need to have vitamin D3 with vitamin K2. That's important. Because if you're taking D3 and you don't have enough vitamin K, the calcium can build up in your blood vessels and can lead to heart disease and clog up blood supply to your brain, your sex organs, your lungs, your spleen. So vitamin D3 with K2, absolutely. We talked about this earlier if you're just tuning in. I don't know anyone, unless you work outside on a regular basis, that wouldn't benefit from taking D3 with K2. And you want to get your blood level tested, I know, because people come in and out of talks and stuff. You want to get your blood levels tested. You want to have 60 to 80 nanograms per milliliter. That's ideal for vitamin D3 levels in your blood. And that's, even we talked earlier, when it becomes actually helpful in cancer. It's not going to cure cancer, but it's helpful in cancer. So you want to do D3 with K2 as well. Very, very important. If you're just tuning in, we're talking today about supplements, drugs, and your health, because so many people take drugs and they don't realize that they're depleting their body of nutrients. Now, the number one medication I see people taking is blood pressure medication. Number two medication I see people taking is a tie. It's tie between cholesterol and diabetes, blood sugar. Now, I'm going to say cholesterol probably wins. I'm going to say cholesterol is number two. So many people take something called statin drugs. Now, statin drugs prevent your liver from producing cholesterol. Slows down the process. Doesn't shut it down altogether. Slows down the process. And so it lowers your cholesterol levels. Brilliant. Works great. There's a catch. There's always a but, right? The same enzyme pathway that produces cholesterol produces something called CoQ10, coenzyme Q10. And so what happens is CoQ10 production is lowered, and CoQ10 helps the cells, the mitochondria, produce energy. And so many health issues are related to the mitochondria getting weak and not producing enough electricity. So if you're taking statin drugs, I also recommend you take CoQ10, because CoQ10 can get into the cells and work again. Now, statin drugs can also lower your ability to absorb fat-soluble vitamins like vitamin A, D, E, K, zinc. So what do? Dr. Joe's Super Greens, Dr. Joe's Essential Source. See how these fit in so many places? Omega-3 fatty acids. I take them every day for my brain health. And as you get older, you should start worrying about your brain. And when you're younger, you start worrying about your brain for when you get older. So omega-3 fatty acids are what's called essential fatty acids. You have to get them from an outside source. And so if you're not eating an amazing diet, which very few people are, in fact, I don't know anybody who eats enough omega-3s, I take a supplement. I have one from algae. That's the purest form of omega-3. It's on my website, drjoe.com. So is Essential Source, so Super Green, so vitamin D, so is vitamin B complex. So I've created a lot of supplements to go along with this protocol so that if you are taking medications, please take the supplements as well. And I don't have a CoQ10 supplement, but you can go get a CoQ10 anywhere. It's relatively inexpensive with statin drugs. But if you do have cholesterol issues, go to my website, drjoe.com, and type the word cholesterol in the search bar and listen to a show we did on cholesterol, because a lot of cholesterol cases are manageable with proper diet. And that's something that medical doctors are not trained in. It's not their fault. That's not their wheelhouse. It's not their specialty. They don't know a whole lot about nutrition. That's why so many doctors send their cases to me and say, Dr. Joe, do a nutrition workup on this patient. Dr. Joe, this guy is too sick to have surgery. Can you get him healthy enough so I can do surgery on him? Dr. Joe, got this the other day. Can I send my wife to you? Orthopedic surgeon. So, yeah, we're pretty good at this stuff. So, If you want to come see us, and who would be a good patient to come see us? In the Atlanta area, I have offices in Marietta, Duluth, Stockbridge, and West Cobb. Who would be a good patient to see us? Neck pain, back pain, shoulder pain, numbness, tingling, headaches, acid reflux, heartburn, digestive problems, nutritional concerns. Go to my website, drjoe.com. Let's see if we can get to the cause of your health problem, not just treat the symptoms. You can book an appointment this week. We have office appointments available every week for new patients in all of our offices, Marietta, Duluth, Stockbridge, and West Cobb. Normally, the first visit with us is $940. Now, that includes an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. The x-rays alone anywhere else are going to cost you more than that. Why do we do this? I do this to see if you are a candidate for treatment. And if you are, then we put together a treatment plan. And even if we move forward from that point, chiropractic care is the most effective, least expensive treatment for pain, for back pain. In most cases, why wouldn't you do the most effective, least expensive treatment? It makes no sense to do anything else. Then we do a nutrition workup on all our patients. I had a patient come in last week in a car accident, and she came in and she got crushed. One car backed into her and crushed her between another car. Anyway, long story. But I noticed she had her gallbladder removed. I looked on the x-ray. I saw staples. And I said, listen, I know you're not here for nutrition, but I'm going to recommend you take this supplement because there's a supplement you should take if you have your gallbladder removed, and it helps you digest fats again. And she said, ever since I've had the gallbladder removed, I've been miserable. Acid reflux, burping, diarrhea. I've been tired all the time. I have no sex drive. They just said, don't worry about it. We tested you. Everything's fine. So I got her on a supplement. It's actually, it helps replace the bile in her digestive system. And every time I've ever done this with patients, they all say the same thing. Why didn't my doctor tell me this? Maybe a penny or two a day is all it takes to take this supplement. I said, carry this with you the rest of your life. Even if we treat you for car accidents, we release you, that's fine. If you never talk to me about nutrition again, I probably just added a couple of quality years to your life. So if you want to make an appointment to come see us for pain, for car accident. Oh, by the way, if you're in a car accident, if the car's damaged, you're damaged. I've never seen it any other way. And I've treated thousands, I'm going to venture to say tens of thousands of car accidents. So go to my website, drjoe.com, book your appointment right away, and let's get you well. You will get phone calls from scammers. If you're in a car accident, come see this doctor, come see this lawyer. It's a scam. It's a lie. It's a felony if they call you. They illegally obtained your information. Don't fall for it. Let me be the captain of your healthcare ship. Let me help you decide where the best place to go and who you can trust. Because healthcare can be scammy, folks. And there's a lot of scammers out there for lawyers and doctors. I don't want you to fall into it. So if you want to make an appointment for whatever reason, drjoe.com, drjoe.com, and we'll get you set up as soon as possible. Please follow me on social media. We post every single day. It's Dr. Joe Esposito. Just look me up. I'm there. If you have any questions, send them to me through my website, drjoe.com, drjoe.com. But when it comes to supplements, supplements are not a luxury, they're a necessity. I can't imagine not having to taking supplements every day, and especially if you're taking medication. So if you're taking medications, again, cardiovascular, ACE inhibitors, it's going to deplete zinc, Dr. Joe's essential source. Calcium channel blockers, vitamin D, potassium, Super Green's essential source, and vitamin D. Potassium supplements going to deplete B12. You need Dr. Joe's B complex. So the standard, everybody says, give me a quickie. Give me a quick version, Dr. Joe. Starter kit, Super Greens Essential Source B Complex, absolutely. Vitamin D, absolutely. Digestive enzymes only when you eat cooked foods, absolutely. And then I take estrogen regulator because at my age, my testosterone is converting into estrogen pretty quickly. I take an estrogen regulator to keep my testosterone from converting into estrogen. I take adrenal support for energy, hormone levels, and inflammation. I take omega-3 fatty acids for brain function. I've customized a plan for me. I'd like to customize a plan for you. I take nitric oxide every day. Nitric oxide opens up your blood vessels and increases circulation to your heart, your lungs, your liver, your spleen, sex organs. Gentlemen, after 40, 50% of men are going to have some erectile dysfunction. And as you get older, the numbers go up. And nitric oxide can open up the blood vessels and increase circulation. Is it going to cure everybody? No, but it's a real good start, and it's a real cheap start. And if you have high blood pressure, I can't imagine why the doctor wouldn't tell you to take nitric oxide, because nitric oxide opens up your blood vessels, lowers the pressure. If you take nitric oxide and blood pressure meds, monitor your blood pressure. And if it goes too low, you got to give up the medication or give up the supplements. You decide, nudge, nudge, wink, wink, what you want to do there. So if you're just tuning in, we're talking today about drugs, supplements, and your health, and how drugs can deplete your body of nutrients. If you're taking a diuretic, You're depleting so many of your vital nutrients. Absolutely, Dr. Joe's Super Greens and Essential Source. Absolutely, B complex. Again, I was going to go across the board, different types of diuretics. It's pretty much you got to replace the nutrients that it's flushing out. So Super Green, Essential Source, and B complex, absolutely. If you're taking hormones, estrogen hormones, let's say, vitamin D, B6, folate, B12, calcium, magnesium, zinc. I'm not a fan of hormone replacement therapy unless it's absolutely necessary. In many cases, there are supplements you can take to help. Pregnenolone is a hormone is a chemical that's produced in your body. Pregnenolone becomes DHEA. DHEA then becomes your sex hormones. So we have a supplement called Men's and Women's Hormone Support. It's DHEA. I take it every day. It's the raw materials that you need to build your hormones. Again, all of these are extremely inexpensive too. So why wouldn't you do these things? I don't know. But I take DHEA every day because I want to make sure I have enough raw materials to produce the hormones in my body. If you're on cholesterol medications, many times if cholesterol goes too low, you need cholesterol for hormone production and for brain function. There are studies coming out now that people on statin drugs have a higher risk of Alzheimer's disease. Why? You need cholesterol for the brain to function. But if cholesterol is too high, it can affect heart disease. So why don't we just straighten out the diet and in many cases solve the problems? Clean out the arteries, lower the cholesterol, get the circulation to the brain, get the nutrients the brain needs, and then you probably won't need those medications in many cases. Not every case, please. I'm not telling you come off your medication. I'm telling you this is what happens when you do these things. And I always tell people, let's do these things and see what happens, and then you can go to your doctor and ask him to take you off your medication or her. Pain. I can't tell you how many patients we've gotten off pain medications, even over-the-counter medications, non-steroidal anti-inflammatories, acetaminophen, ibuprofen. Chiropractic care, most effective, least expensive treatment for pain, back pain. We use something called acoustic wave to break up scar tissue in the joints, and many times people, you're on the way to getting a joint replacement or been told you need it. Hopefully we can fix it. We can do PRP injections. I had a patient call me the other day on my radio show and said, my doctor did surgery on me. It didn't work. Now he's recommending PRP. Why didn't we do PRP to start with? And then if it didn't work, you can do surgery. I like that approach a lot better. So if you want to make an appointment, drjoe.com. If you have any questions, send them to me through the website, drjoe.com. Gentlemen with ED, if you have ED, go to my website, drjoe.com. Type the letters ED in the search bar. 6-question quiz is going to pop up. Answer the questions, email it to me directly. If I think you're a candidate, I'll send you an email to talk about getting to the cause of the ED. I'm not treating ED. I'm treating the cause of the ED, and then hopefully the body starts to work normally again. Folks, I got so much more to talk about. I just don't have the time. Again, if you have any questions, drjoe.com. Go to my website. We have over 4,000 hours of content there. You can search the website for any topic you're looking for. Chances are we've done a show on it. If you have questions specifically, send it to me, and I'm happy to answer it. If you're a podcast junkie, go to your podcast service. Type in Dr. Joe for the health of it. Dr. Joe for the health of it. You get 2 podcasts a week from me. If you follow me on social media, you're going to get announcements on when I do my shows, little pop-up lectures, radio shows, podcasts, and why not? But really the thing to do is sign up for the newsletter because not everybody's going to get everything on social media. It's right on the website, drjoe.com. Sign up for the newsletter. You'll get an announcement every time we do anything. If you don't like it, don't open it. Don't follow me anymore. But I want to get this information to you. I want to be your doctor. I want to help get to the cause of the problem, not just treat the symptoms. Folks, I'm Dr. Joe Esposito, drjoe.com. Thanks for tuning in. We'll catch you next time. Bam, right to the second. I had so much more to cover. Always. Gosh. All right, John, you got questions?
What do you mean when you say liver damage?
You can get fatty liver, and if the liver gets fatty, it kind of fat builds up in there and it can't do its job. You can get scar tissue like cirrhosis of the liver, and then the liver just can't do its job properly. You can physically damage the liver too. I mean, you get punched in the gut. But usually chemically, we're looking at cirrhosis, which of course is alcohol or fatty liver, and then the liver just gets clogged up and can't do its job.
For those taking valacyclovir, a herpes medication, how does it affect the liver?
Again, I'm not telling you to take or not take drugs, but if you're taking a medication, don't stop taking it. It can cause the fatty liver, basically what we just talked about, and that's why I'd recommend Super Green Essential Source, glutathione, vitamin D3, and B complex to try to get the nutrients in the body so the body can heal.
Do walnuts act as a natural enzyme support?
Yes, if they're raw. Now, walnuts can go sour pretty quick. So if you buy walnuts, put them in the freezer. But if they taste even slightly rancid or off, throw them away, because the only thing worse than not enough good fats are rancid fats. So throw them away if they taste bad. What else?
How much is an appointment to get my stomach adjusted?
Well, again, the first visit is $299, because if it's just the stomach, I have one patient that only comes in for her stomach, and we see a lot of patients. And the reason is she's under chiropractic care with someone else who's a friend of hers, so she doesn't want to upset her friend. But usually when it comes to the stomach, I want to check the nerve supply to the stomach as well. I want to do nutrition workup on you, and that's why we like to do the $299. For the exam, x-rays, consultation, we'll check the stomach, we'll do nutrition evaluation, and let's see if it's just the stomach. Rarely is it just the stomach. But if you insist, I don't argue with patients. If you insist, my staff will talk about it with you, and we'll set you up an appointment just for that. You're probably not going to get the results you want, though. But I'll do it.
What is the glycine? Is it good for gut health?
Glycine? Oh, yeah, it's okay for gut health, but it's not going to be the end-all, be-all. You need a lot more. There is no one thing that's going to cure everything. You know, people say, well, Dr. Joe, isn't vitamin C good for a cold? Yeah, but there's a lot more to it than that. Vitamin D can help with bone health. Yeah, but there's a lot more to it than that. So you can take glycine if you want to, but you really want to make sure you get all the amino acids, and you do that by fixing the digestive system with digestive enzymes, adjusting the stomach. Super Green's an essential source. That's a better choice. So again, there is no one end all be all for anything. So.
When is the best time to take digestive enzymes? Before, during, or after the meal?
You could take it right before or during or after. I mean, as long as it's in that time frame, like you start eating, you're done eating, it's in there, it's fine. If you wait an hour, it may work, but not as well.
Do blood sugar spikes contribute to diabetes over time?
Yes, that's what diabetes is by definition. High blood sugar, yeah. So blood sugar spikes bad. That's why I want to eat a lot of fiber. Fiber pushes everything through the colon, gives you a slow release of sugar. And one of the secrets to diabetes control is high fiber food. So.
I think I have tendonitis or bursitis in my right arm. What is the best supplement I can take to help with the pain?
Turmeric is probably going to be your best bet. It's on the website, drjoe.com. Turmeric and B complex. Of course, Super Green is an essential source everybody should be taking anyway. And again, that might help, but if you have tendonitis, why do you have tendonitis? Have you overused it? Is the arm out of place? If the arm goes out of place, it puts stress on the tendons. Is there a pinched nerve in the neck going to the arm? So you can try the supplements if you want. If it doesn't get better, come see us. We could do cold laser, acoustic wave, see if the joints are out of place. It's usually a lot more than give me a pill and I'm going to fix it. But you can try it if you want. Yeah.
That is all.
You guys are great. Thank you so much. Please follow me on all platforms, Facebook, Instagram, YouTube, TikTok. Do me that as a favor. I'm happy to answer your questions. That's your cover charge for today's show. And if you want to make an appointment, which you should, just go to drjoe.com, and we'll talk to you soon.